Okay. Hey, Sarah, welcome to the podcast. How are you?
Good. Thanks for having me, Rebecca. Happy to be here.
Yeah. How was your workout?
It was good. Those push-ups, they're tough.
Yeah, that was a lot of push-ups, Jason. That was like 100 push-ups.
I know. Right? I thought I could do them all, not scaling, but I had to scale them.
Yeah, I definitely had to break them up. Well, can you tell us a little bit about your job, what you do, how you came to Hustle One, all that stuff?
Yeah, sure. So, I guess I'll start with my job.
Yeah.
So, I am a pharmacist at the VA hospital downtown in Charleston, and I work on our inpatient internal medicine service. So basically, all patients who get admitted to the hospital, they get assigned to an internal medicine doctor. They come in for a variety of problems, a lot of heart failure, kidney failure, various infections. And then so as the pharmacist on the team, I go to talk to the patient, usually within 24 hours of getting admitted to the hospital, figure out what medicines they were taking at home, and figure out like if they were taking their medicines as they were prescribed. Oftentimes there's a lot of discrepancies versus what we have in the computer versus what they're doing. So I kind of relay that information to the doctors and help the doctors to make decisions about treating whatever diseases the patient has. So usually the physicians are like, okay, these are the diagnoses we're making. And then as the pharmacist, we help them to use evidence-based guidelines to come up with the best medications. And then when patients are discharged from the hospital, we make sure the patients are well educated on the medicines that the doctors are sending them home on, making sure they have good follow-up with whether they're going to see a pharmacist on discharge or whether they're going to see their primary care doctor. So really just making sure the patient's medications are taken care of from the start of their hospital stay to the end of their hospital stay.
Okay. And is this like the ICU, or is that like step down floors, or like?
Yeah, so we see patients on the general medicine floors.
Okay.
So we have pharmacists all over the hospital, but my focus is on patients that are admitted to a general medicine floor. They're not sick enough to be in the ICU, so they're generally like able to talk to me, or their caregiver can talk to me. Yeah.
So you said like a lot of discrepancies in like their medication list. Is that a lot of that coming from like patient non-compliance, or is it just from like old prescriptions that they're still taking even though they really don't need to, or like what are some of those from?
Yeah, so definitely a variety. Sometimes patients their primary care doctor will write them a prescription, and maybe then they don't tolerate it so well. So maybe their primary care doctor says, well, okay, instead of taking the full tablet, maybe just take a half a tablet. But then the doctor doesn't update the prescription in the computer. So the next person who comes behind doesn't know that. So sometimes it's some of that. Other times it is just that the patient isn't necessarily taking what the doctor told them to. Maybe they're missing doses throughout the week, which could have led to, different things being out of range, leading them to come to the hospital. So it could be due to maybe the patient lost their medicines, they're just not taking them. So a variety of, sometimes patients just like to do what they want. So
yeah, absolutely. I was really excited to talk to you today because I have a lot of questions about drugs.
Okay. Okay.
So are there any drugs that you think are overprescribed, and are there any drugs you think that are underprescribed, and what are they?
Oh, that's a great question. So I do think that, in my area of practice, I'm very isolated to
you're specialized.
Working at, especially, I'm specialized in, in an internal medicine setting in the hospital, but also specialized in the sense that the VA is a little bit more stringent. We have a very strict formulary, so we only can prescribe the medicines that we have available to us. Now we have most of the highest level medicines that you can be on for a lot of the common disease states. We have those available to us. So I think our veterans actually have great access to state-of-the-art medications. I think outside of the VA, I'm sure that people hear in the news all the time of medicines being overprescribed, and some medicines being underprescribed. So in terms of being overprescribed, I don't know. I mean, I think there's certainly a time and a place for everything. So I don't think I can necessarily comment on things being overprescribed. I think being underprescribed, we do see a lot of patients with that do come from the community. So maybe we're seeing physicians outside of the VA. And one of the things that we do, I think very well at the VA is really prescribe according to evidence-based medicine. And then, so one of the diseases we see a lot of is heart failure.
Yeah.
So within heart failure, there are about four classes of medications that all patients should be on to improve their life expectancy. And some of those medicines are very expensive. So maybe outside of the VA, they would cost people hundreds of dollars a month.
Yeah.
So the copays that people are paying at the VA are much less. So I think for that, within heart failure, I think there's some opportunities for improvement. I think within diabetes, we see a ton of diabetes at the VA as well. There's a lot of new medicines out there that have been developed over the last 5 years that not only improve diabetes control, but also can improve cardiovascular risks associated with diabetes. So those are we hear about the GLP-1s all the time for weight loss, but really those came about for diabetes, and they're really great medications for diabetes to help manage blood sugar, but also to help patients improve their cardiovascular risk.
So do a lot of those GLP-1 medications for diabetes, do they work by appetite suppression, or are they directly acting on the pancreas and insulin sensitivity and all that?
So you pretty much, they kind of work in four different ways. So they kind of, you kind of hit it, they decrease or they increase satiety. So they basically make you feel full faster. They increase your body's natural secretion of insulin, which is going to drive down blood sugar. And then they're going to mimic glucagon, which is going to basically prevent your body from making glucagon, which is going to make your blood sugar go up. So those are the mechanisms that it's working by to reduce blood sugar, and then also decrease gastric emptying time. So basically kind of slow the transit of food.
Okay. Very interesting.
Yeah.
So when you see a patient, how does the education process go about when you're educating them on taking their medications? Because I think that is a big problem for a lot of people. They have to learn a whole new routine and a whole new habit of I gotta take this medication at this time.
It's so hard.
At this dosage. And I mean, if it goes wrong, that's obviously pretty bad. So the consequences are high if they don't follow their routine.
Yeah.
So what is that conversation like?
Yeah. So I think one of the hardest things is when someone comes to the hospital and they've never been on medicines before and they don't really have a routine around it. We have a lot of patients that have been on a lot of medicines for a long time, so they have a routine, but it's really about setting up that routine. We talk about it a lot at the gym, setting up a routine, setting up a routine for your fitness, for your diet. So it really becomes like a bar. We talk a lot about habit stacking too with taking your medication. So if it's a medicine that needs to be taken with food, can you set it in your kitchen so you're going to remember to take it with your meals? If it's a bedtime thing, can you take it, put it with your toothbrush, so it's something that you're remembering to do at bedtime. So really, a lot of the same habits that we talk about at the gym really come into play with figuring out a good habit, a good routine for your medicines. And so that's a big thing that we focus on, is getting into a routine. And then in terms of providing education, we really try to focus on why are you taking this, why it's important. Making sure patients know the names of their medicines, both the brand, the brand.
The names are so hard.
Yeah, and when it's incredible how many people, a lot of our veterans are male, how many of our patients just allow their wives to give them whatever.
Yeah.
That, to me, that blows my mind. I'm like, you trust your wife that much?
Yeah.
Really focusing on what the medicine is, why they're taking it, how many times a day they're supposed to take it, if there's things, if they need to avoid taking it with food or without food, and then knowing what the side effects are. So knowing what to look out for if you're, if you feel like this medicine is causing you problems, so they know that they can report that to their doctor.
Okay.
So really trying to narrow, really providing them information, but not overwhelming them either.
Good. Okay. Yeah. I mean, that sounds like it would be a pretty tough job. Maybe one of the toughest parts of it.
Yeah, especially when they have a bunch of new medicines.
Yeah, and they all have really hard names.
Yeah.
I know that was tough for me in PT school. Was the one pharmacy class I took was remembering all the names. Yeah. So I can't even imagine going through.
Oh yeah.
How long is pharmacy school?
So pharmacy school is 4 years, and honestly, there's new drugs coming out all the time. I can't keep up with all of the names either.
Yeah. And they're hard names.
They are. Like, a lot of the newer ones are really hard. So sometimes if I have like a patient, like a medicine on a patient's list, I have to like Google the pronunciation before I go talk to them. Yeah.
Well, luckily they probably don't know it either. So I'm guessing.
Yeah, exactly.
What made you like get interested in pharmacy? What made you want to be a pharmacist?
So I really liked math and science and stuff. And when I was in high school, like looking for a career, so that was kind of like I was kind of focusing on that kind of angle of stuff. And I didn't really. I knew I wanted to work with people. Like I knew I didn't want to like kind of do research or like go into engineering or anything like that. So my mom was in healthcare. My uncle was a pharmacist. So I kind of did a bunch of shadowing. I shadowed a physical therapist when I was in high school.
Oh, really? You're just like, no.
Well, I don't think it was the best physical therapist. I think had I shadowed someone like you, I'd have been like, oh yeah, that's what I want to do.
Okay. That's good.
Yeah. And so and then my uncle was a pharmacist. So I think when I ended up doing some shadowing with him, he like made it sound really cool. I was like, oh yeah, I want to do that. So.
Yeah. I'll be a professional drug dealer.
Yeah.
Well, let me ask you this. What made you decide to work at the VA and not at Costco? You could have been a Costco pharmacist.
I know. Well, then you could have gotten probably a really great discount at Costco.
Yeah.
So.
You could have probably gotten a free membership. And...
Wow. I maybe need to rethink my career choices.
Yeah.
So one thing that I have so much respect for pharmacists that work in the like retail setting. They deal so much with insurances and complicated patients. Their patients are coming in from seeing all different providers.
And probably people think that they're like retail employees too, I bet sometimes.
Well, and I don't think that retail pharmacists get the respect that they deserve. I really like the collaborative environment of working in a hospital. Yeah. I think that I work, while I do work a lot with patients, I really collaborate a lot with physicians and nurses. I do some like, kind of like basic level research stuff there too. So I think within the VA, I actually get to practice, we always say like practice at the top of our license basically. So we can do a lot of things at the VA as pharmacists without a doctor's order. We have what we call like a scope of practice. So we get like credentialed every couple of years and we can order lab tests and order certain medications and adjust medications. So we get to really do a lot as pharmacists at the VA. So I really like the fact that we get to kind of, I guess, work on a very high level.
Yeah. I think that's always fun to work like as part of like a team. Like I remember that from when I was a student shadowing or doing my rotation at hospital. It was like you got to work with the OTs and like the respiratory therapists.
Exactly.
And like it's really cool.
And we have therapists on our team that we work with too very closely to make sure patients are like safe to go home and like so we work with a lot of different groups of people.
Very cool.
Yeah.
Do you find that like maybe both in the retail setting and in the hospital setting, do you find that the patients are generally like prescribed, like the doctors prescribed like lifestyle modifications too, in addition to like the pharmacological interventions? Like, because I think they go like hand in hand really well.
Oh my gosh. So I totally agree with you. I think they definitely go hand in hand. I don't think patients get enough of it. Okay. Quite honestly. So we have, especially from a physician standpoint, especially primary care physicians are so busy. The amount of paperwork, the complexity of the patients that they're taking care of,
and the volume of patients that they're seeing a day.
It's insane. So that's a whole other topic. But I think that there's room for more lifestyle modifications. I think that one thing that I try to do when I talk to patients specifically about diabetes. I feel like within diabetes, that's like one of the biggest areas for lifestyle modifications.
Diabetes is so interesting.
And really just trying to talk just even a little bit about diet and stuff like that. Not, so I actually had a patient a couple months ago who was newly diagnosed with diabetes, and he was so interested in all of nutrition information and understanding more. But I would say that that's not the norm. Most people don't necessarily want to. Making lifestyle adjustments is really hard.
It's really hard, yeah.
And especially if you're older and been doing some things for a really long time. So I do think there's more room for lifestyle modifications. But when I do get a chance, I always try to dabble a little bit with nutrition and stuff like that. But there's in general, I would say, in the population I'm working with, there's very low overall knowledge about a lot of like nutrition stuff.
Yeah, low health literacy.
Yeah.
I think is just a pretty big
Yeah.
problem in general.
Mm-hmm.
And yeah, it's tough too when the physicians are so overworked because I mean you got such a high volume of patients.
Exactly.
And, like,
Yeah. Right. Well, they have 20 minutes, you know, to do their interventions and everything they have to do, and you know they have so many boxes they need to click on the computer and stuff like that, and it's just.
Do you guys get to have like medical scribes at all?
We don't that I'm aware of. We can use this program called like Dragon, so you can like it's like
Is that AI?
No, I think it's like a headset you wear and you can like talk to the computer and it like transcribes your note for you.
Oh, okay, that's kind of cool.
Yeah,
really cool. Well, how did you get into like working out and fitness and stuff? Because you've been coming here longer than me.
Yeah, so I've been in Hustle One for 5 years, since like 2020.
Yeah.
So a very long time. I've actually been into fitness for a long time. I ran cross country in college and in high school, and then after that I ran.
You ran cross country?
Uh-huh.
How come you didn't do the Kiowa Marathon with us? What a missed opportunity. Dang.
I know. Well, then after college I did run marathons and half marathons.
That's so. What the heck?
And I
should have peer pressured you harder.
And I ran, I guess, 3 marathons. I run, oh my gosh, probably maybe 8 to 10 half marathons.
Wow.
And after my last marathon, I was like, I'm done running. I couldn't do it anymore. So that's when I kind of was looking for something different. Mm-hmm. At that time, I was like just moving to Charleston. Mm-hmm. So I started at a different CrossFit gym that's no longer in the area. So I've been doing CrossFit-ish workouts for like 10 years. Mm-hmm. Okay. And then, yeah, so then when Hustle One opened, like 6 years ago, I saw them, and a couple of people I knew from the other gym I was at had kind of moved over here, and they looked like they were having like a great time, super welcoming community. So I've been here for about 5 years now. So fitness has always been a part of my life, but kind of has transitioned from the running.
Have you ever thought about getting back into running?
Yes, sometimes when I do go for runs, I do like it. It's so hot in Charleston.
I know. In the summer.
Yes, and it's so flat here. Like I used to love running, but I find it very hard to get into running in Charleston.
Well, if you're looking for hills, I mean, there's this very slight incline on the bridge.
I know.
It feels a lot steeper than it actually is, but it's a little something.
Yes, that is true. So maybe every now and then I kind of get the itch to do it, and I'll go for like a run for a few times, and then I'm like, okay, I'm good.
Yeah, I mean, this is a good time because second fake fall.
Yes, I would say this is a good time of year to do it. Mm-hmm. Yeah, maybe this will be the year.
Cool.
I feel like there's still time to like train for the Kiowa Marathon because that's in December?
Absolutely. Yeah. It is like I think they closed their registration, but you can always get on
next
the wait.
time. It's okay. Next year. It's okay.
You don't seem very disappointed about that.
I'm not.
Okay, well, I have one more question for you, and that's what's your favorite part of your job?
My favorite part of my job?
Yeah.
Well, I think we talked about this earlier, but I really like the people I work with.
Yeah.
The other pharmacists I work with are super smart. We are collaborating all the time. We are constantly like bouncing ideas off of each other. I really like the physician team I work with. So I think it's just really the people I work with. And honestly, that's like the one thing that keeps me going back every single day. I feel like, especially at the VA, I feel very appreciated. I feel like the patients very much appreciate having us as pharmacists. They have a lot of access to pharmacists. It actually probably better access to pharmacists than they do physicians. So there's a lot of pharmacists that work in different areas of outpatient pharmacy that contact patients all the time. So I feel like patients are very appreciative of us as well. So
that's good.
Yeah, just all the people I work with, I think, are probably the best part.
That's awesome.
Yeah.
Yeah. I think it doesn't even matter what job you do. If you like the people that you're with, you're going to like your job.
Yes, exactly. And I'm that kind of person. I like being around people, so as long as the people are good, then sometimes the other stuff doesn't matter as much. Yeah. Cool.
Well, thanks so much for jumping on it. I think this is awesome.
Oh, good. Well, thanks for having me.
Yeah, absolutely.